Hey, everybody, and welcome to this episode of our Wellbeing at Work podcast. My name is Christy McGuire, and I am the Vice President of Business Solutions for the Americas at Workplace Options. I am so pleased today to welcome Dr. Jasmine Kaur Malhotra with a professional doctorate in counseling psychology and expertise in CBT, psychotherapy, EMDR, ACT, and DBT modalities. Dr. Jasmine, our Director of Child and Adolescent Clinical Care, is a seasoned professional with more than a decade of experience as a senior counseling psychologist. Thank you for being with us today.
Hey, Christy. Thank you for having me today.
So, Dr. Jasmine, WPO recently launched a new program called Child and Family Wellbeing, led by you. Can you talk to us a little bit about this program?
Of course I can. We are very excited about this unique launch at WPO. The Child and Family Wellbeing Program has been developed as an add-on service. We've now launched in 70 plus countries and are still expanding, offering services in local languages wherever possible and aiming to serve our users 24/7 and 365 days a year, which is pretty impressive. The program was actually developed in response to the current challenges families across the globe face in accessing appropriate mental health support. I mean, some of these challenges include limited resources, really lengthy waiting lists, forcing families to sadly pursue expensive private assessments, the presence of stigma and taboo being present in some cultures. And we have also noted inadequate infrastructure in some regions across the globe, making it really challenging for families to access the level of care their child might require. Now, we at WPO want to facilitate access to care. We're really sort of passionate about this service user, and we want to reduce the stress a parent or a guardian experiences in trying to navigate the most appropriate route forward for them and for their child. And our program seeks to support families with minors from the ages of 3 up to 18 years of age. We offer a range of specialist therapies tailored to their specific needs and also factoring in the stages of development. During our clinical intake, which we serve across the globe, we engage in a specialist pediatric assessment with the parent and the guardian, which incorporates holistic principles very close to the philosophy of WPO. And via this clinical tool, we assess whether a one-to-one intervention is required or whether a systemic approach would be of more benefit, such as family therapy. These services can, of course, be accessed in person, via structured video counselling, or even telephonically. So essentially, Christy, we aim to offer ease and flexibility. Whilst the clinical intervention takes place, we would assign a paediatric case manager to the case to support the family with any clinical queries that they might have and to complete child-focused outcome measures, which we call the Strengths and Difficulties Questionnaire. This is used to evidence the outcome of the clinical intervention being offered. Now, we also recognise and appreciate that every child or family may not be ready to take the step towards therapy, especially when complex circumstances are involved. And to address this, we have care coaches on board in the program who work with families to develop personalised care plans, offering support and guidance throughout the process. Both of our care coaches and case managers have a unique set of skills and experiences to allow them to support minors and families to that high quality service that we would aim to deliver. So there's so much to this program that we could sort of talk about, but that's the gist of it. And like I said, we're really passionate about this launch because it is specialist and we know it's filling a need and a gap.
Yes. What are some of the common issues that this program addresses?
Of course. Really good question. So we recognize the well-being of the child is deeply connected to the environment in which they grow up in. Now, this can include the emotional and physical health of their entire family unit. We assess all needs via the power of a good conversation, and the program seeks to provide solution-focused support for a range of clinical presentations and via a short-term model. So some of these examples could include addressing difficulties like grief, trauma, emotional and behavioral challenges, anxiety or depression, and by setting realistic goals and focusing on successful strategies. Now, these solution-focused approaches also assist with family conflict, any academic or social concerns that might be present, even adjustment to life challenges and parenting support by identifying and building on existing skills and positive experiences. So the approach very much fosters resilience and practical problem solving, enabling minors to effectively manage any challenges and make meaningful progress. We are essentially supporting families and empowering children. Now, we also evaluate whether parents or guardians might need their own clinical space to address their own challenges, or if a child requires any neurodiverse support or access to specialist interventions. Our pediatric assessment allows us to collect enough data to make the appropriate clinical decision. So we guide parents and guardians on identifying appropriate resources and connecting the family with specialist professionals that they need in order to progress forward.
You know, I have 3 children myself, and I think one of the most stressful thing is when you see something going on with your child and you're not really sure what to do. Where should I go? How do I start? You know, maybe do they have a problem? Do they not have a problem? Can you speak to some of the early signs of mental health issues among children that parents need to watch for?
Yes, of course. And like you said, it's not easy parenting a child in today's age because there's so much to consider, and we have access to sort of digital methods that we didn't before. We have access to information, self-diagnosing tools, and also social media, which can often get us thinking as a parent. But key signs parents and guardians can keep an eye out for include any physical concerns. Sadly, we live in a day where, self-harm can take place. So please take a note of this. Significant changes in mood, for example, persistent sadness or even irritability, signs of social withdrawal, and a general lack of interest in the usual activities they tend to enjoy. Excessive worry or fear might be present. The child might report experiencing difficulty concentrating at school. You can also note any changes in appetite, weight, or even sleep patterns. Now, these are common changes to look out for, and we are here to support parents and guardians with understanding what these shifts truly mean. We at WPO recognize early help and intervention is crucial because research has shown, timely support can help minimize disruptions to the child's education and their social development, ultimately fostering a more stable and positive future. The reason behind the philosophy of our program is if we can detect any challenges earlier on, we can equip the child with the coping skills, improve any family dynamics, and promote resilience across the family unit. So these are some common ones or common areas to think about. But we, of course, understand there is so much information you can absorb. So we are here to support parents and guardians with taking a step-by-step approach.
Yes, one of the other stressful things that I know parents deal with, especially if you're working full time, is, if your child's dealing with something and you go see someone and you're sent in 1,000 different directions and there's no plan in place. There's no care plan. Somebody just says, hey, this is everything you need to do and here's all your support. It can be really, really hard, and it can be really hard on the parent and their well-being and their own stress. Can you give some suggestions on how parents can manage their own stress and well-being to better support their children, especially if they're going through something with a child that is struggling?
Yes, of course. I mean, as a child psychologist working in this field, Christy, I often hear it's very easy to forget about looking after your own self when you have children, that their priorities are at the forefront. Now, we know children are like sponges. They absorb behaviors and attitudes from all of their surroundings. So it's really vital that parents and guardians take a moment to have a check-in with themselves to understand, how am I managing? How am I doing? And also for them to model healthy coping mechanisms for managing stress, because those kiddos are picking up on everything. First, recognizing that those feelings are present and then attending to them in a healthy manner. Now, we don't dismiss a child who might be overwhelmed or crying, right? We sort of jump to comfort and to sort of help them self-soothe. We respond with empathy, and parents deserve the same. So it's essential that we remember compassion has to start with the self. So some examples that you could use to manage feelings of stress could include prioritizing your self-care. It's a hot one. Maybe through regular self-exercise. Establishing that mind-body connection really helps me as a person to put my thoughts into perspective. I find pushing myself physically helps me exert any feelings of stress that might be building up internally. Balanced nutrition is also key, and I can't emphasize this anymore. So is good sleep hygiene. If you look after yourself, you can look after your little ones and encourage healthy habits. Taking time out for yourself is important. I know some parents can experience feelings of guilt. However, allocating time for relaxation and your own interests will help you sort of recover, and so you can attend to the needs of your child. When we talk about relaxation and personal interests, I mean, I love to end my day with a hot bath or to go for a trek on the weekend. Spending time in the outdoors helps me, again, put my thoughts into practice. Being strict with your schedule and ensuring you have this slot for yourself, be disciplined for it. The same way that we don't forget about, I guess going on our laptop or, scrolling on Instagram or social media, have that dedicated time for yourself. I know we all have our own sort of personality, so we have our own go-to hobby, which may lift our mood or make us feel at ease. So you could explore things like yoga, mindfulness, creative arts, or even simply watching your favorite series. I mean, Friends is a common topic a show that I hear about. But we have to remember, Christy, it's normal experiencing those high days and low days. So build a supportive network of friends and family who you can approach if you need some emotional support or even some practical support. It's okay to say that you're struggling, and we want to teach our younger years the value of acceptance over dismissing any hardships that one might be experiencing. Maintaining your own health and well-being as a parent enables you to provide the consistent and nurturing care that you want to for your minor. So take out that time for yourself.
I know when people go through difficult times in their life, especially when you're worried about your own children, a lot of those things, if you're not aware of them, go out the window and you don't practice that well-being that you need to support yourself to get through those times. So I know it's always beneficial to have a coach or have someone reminding you of, hey, don't forget to take care of yourself. Don't forget to keep your nutrition up or your sleep. Having that support and that reminder is so key, because there's a lot of people that aren't even aware that those things can actually help you get through those stressful times. Mm-hmm. How do you see this program benefiting working parents that may be going through this today or about to go through something with their children?
Yes, of course. So I guess, like you said, we can neglect our own needs until someone really pushes us to focus and sit and to assess what's going on and why are things not connecting. So you're correct. A care coach can help you develop that care plan for you, for your child and the family. But your needs are just as important. And hence we call this the Child and Family Wellbeing Program. We want to support all that are involved. And it can feel challenging when you're sort of stuck in that bubble or that headspace. Now, I see so much value in this program as it seeks to fill a gap, and there is real need of services of this nature. Now, I'd like to highlight 3 key stats which evidence that sadly there is a large children's mental health crisis across the globe. And for us to understand some of the challenges parents and guardians currently face, we need to, highlight that there's a need, but also acknowledge the challenges and the barriers that are present to be able to make any positive shifts. So to begin with, the World Health Organization has now stated that mental health disorders affect 20% of children and adolescents worldwide. Rates of anxiety and depression have increased by 50% in the last decade. It's a shocking stat, but it's the reality of today. UNICEF has also highlighted 80% of young people suffering from a mental health condition will be undiagnosed and untreated globally. And this often results to symptoms becoming quite chronic and debilitating. Through the stat, we can see the key barriers to care that do exist. And lastly, we need to assess the impact on families and parents and guardians. So a study published in Pediatrics highlighted actually 70% of parents report high levels of stress related to managing their child's mental health needs. Now, this is affecting not only their own well-being, but also their ability to support their children. It's fair to say it's not easy parenting and raising your children today's day and age. And we at WPO recognize the urgency of addressing these mental health crises, and we seek to equip parents and guardians with the resources and the support that they require to be able to attend to their child's emotional and developmental needs. We understand that taking that first step is really overwhelming and can feel confusing, often questioning, where do I begin? Or there are so many options and there are so many routes to pursue. And hence, families end up spending a lot of money in private assessments. But here we aim to provide ease and we aim to provide comfort for the working parent, and our program seeks to reduce any parental stress. We want to enhance family cohesion and we want to improve the quality of life for both parents but also their children, so then parents can perform more effectively at their workplace. It's not easy trying to provide and to parent, like we say, there's no manual for this. But we aim to provide a solution here with this program, and we want to support as many families and minors across the globe.
This has been wonderful. So much great information. Thank you so much for joining us today. To learn more about the child and adolescent clinical care for your employees, contact your Workplace Options representative, or you can email us at service@workplaceoptions.com for more information. Contact details are also posted on this page. Dr. Jasmine, thank you so much for joining me on this episode of our Wellbeing at Work podcast. And to all of our listeners, we hope you found this conversation insightful. Until next time, take care.